Okay, so lecture today is going to be about cardiovascular murmurs. So that's going to be physio, murmurs, and then I'm going to talk about the hypertrophic cardiomyopathy murmur and mitral valve prolapse. So those are the two I'm going to be talking about. So when we're thinking about heart murmurs, just in general, the first thing you want to ask is it systolic or is it diastolic? That's your first main question. So it's really easy to think about your murmurs this way. So you can go, here's systolic, and systolic. So now the next question you ask, is it worse with decreased preload, or is it worse with increased preload? I mean, if you differentiate it this way, like, it's going to be so much easier for you, because then the murmurs will just make sense. So this, we have two here: hypertrophic cardiomyopathy murmur and mitral valve prolapse. Here we have obviously a couple other ones, like aortic stenosis is going to be here. There's a couple other ones here actually. VSD. Pulmonic stenosis is also here. And I understand I'm using a lot of abbreviations, but just bear with me for the moment. So, is it a diastolic murmur? So, just so you know, systolic murmur is S1 to S2, do, 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 right? So, the murmur's in this area, whereas a diastolic murmur, the murmur is, so here's S1, here's S2, here's another S1. Notice how the space between here is longer than here, so it's do, some space, do, right? The murmur is going to be here in a diastolic murmur. Okay, so the diastolic murmurs, the question you want to ask here is location. Then we have axillary. Then we have pretty much the left sternal border. Could also be the right sternal border. This is going to be mitral regurg if it's axillary. And then if it's left sternal or right sternal border, there's aortic regurg, but there's two causes of aortic regurg, and we'll get into those. I'm getting way too into detail with this. Okay, so systolic or diastolic. Is it systolic? It's between S1 and S2. Do is there. And you have it is either worse with decreased preload or is it worse with increased preload? This is what we usually think about, is the worse with increased preload when you think about your murmurs, because preload means increased blood, right? Preload means increased blood flowing through the heart, and therefore we kind of think of that more. It's like, okay, well, if they have more blood, doesn't it, when you have more, this is like physio now, if you have more blood going through a hole, it increases the sound that's given off, right? So that's usually what we think with these, right? But then this one is really unique, and that's why I'm talking about hypertrophic cardiomyopathy and mitral valve prolapse. These are very unique in that when you have increased blood, they actually get better. These actually get better. You have less sound, and that's what pretty much we're going to be talking about. So, okay, so let's talk about the hypertrophic cardiomyopathy murmur first. Hypertrophic cardiomyopathy murmur. And hypertrophic cardiomyopathy, there's two main ways that it can be caused. I'm not going to get into this detail right now. One is the inherited autosomal dominant pattern, and then one is going to be acquired after long-term hypertension. And I will explain that when we talk about more pathology, okay? But right now, I want to talk about the murmur itself. So remember, the murmur here is systolic. Like we said, remember we were differentiating it. This is systolic, and this is worse with decreased preload. So it's better. So it's better with increased preload. The disease here really happens in the septum of the heart. So if we were to draw a normal heart, and you can, I encourage you to draw this with me. I'm not a very good artist, but So here's like the septum, and then if you imagine the patient right now, this is like the right ventricle right here. This is like the left ventricle in here, and then I like to draw the aortic valve. I'm sorry, the aorta out of here, out of the left ventricle. So the aorta comes out of the left ventricle, right? So left ventricle flow goes this way. And back here, let's just draw a left atria. So blood, we know, goes from the left atrium, from the lungs here, and then it goes into the left ventricle. Well, what does it go through here? It goes through a mitral valve, which the anterior leaflet of the mitral valve, that detail is not very, I guess it's kind of important, but here's the anterior leaflet of the mitral valve, so let's just call this the mitral valve, right? It's next to the aorta here, and blood goes from here, and then when this pushes blood up here, this of course has to close off. The mitral valve must close off during systole, because systole is when the heart contracts this way. The left and right ventricle contract this way in order to push blood that way, right? So that's systole, and blood must go through the aorta. So the issue with hypertrophic cardiomyopathy, so this is normal. The issue here, let's draw this again. Now this time here, I'm drawing the septum first. There's this really big bulge here when I draw the septum. And here's the left ventricle. Here's the right ventricle. Okay, what's going on here? So there's this big bulge, and here's the septum. I'm going to just label this septum. I should have labeled that up there as well, but you get the idea here, right? There's this big bulge here. And so when we have our left ventricle, and we draw, now I draw my aorta again, right? Notice that there is not much space here, and that's kind of awkward. So let's draw in our left atrium again. There's no space here. So if I had my mitral valve here, this must close off. That wasn't right. This must close off, right? We said must close off during systole, to allow blood to gush from the left ventricle into the aorta. This has to close off here in order for this to stay open. The issue is the proximity of this is so close to the septum, or I should say it's the other way. The septum is so close, approximately here, that it creates sort of like a vacuum, and this sort of comes forward and blocks off the outlet of blood from the left ventricle into the aorta. Do you see what's happening here? So anterior motion of mitral valve blocks off the aorta. Blocks off blood flow from LV2 into aorta. Okay, that's what's happening. That's the pathology right here. And so when it gets really close to this, you can imagine somebody with this. Remember we said in physio, if there's a small hole somewhere and there's blood flow through it, you hear it as a murmur, right? So there's a smaller hole that's created here, and this is where you hear the murmur. That's a systolic murmur. That is a systolic murmur when you have, remember, systoles, these are closing, blood gushes through here. That's just the physio of it. When you close something, you know when you like squeeze, like, I don't know, like a water balloon or something in a certain direction, it'll squeeze the blood through. Blood gushes through here. So this isn't always closed. So you can imagine that if you had like a young runner here who's running a lot, their heart rate goes up. So the heart rate goes up. When you have the heart rate go up, there's less time for the heart to fill. Okay, so there's less time for the heart to fill, so as the heart rate goes up, preload goes down. The amount of time for the heart to fill goes down. And so this is really key here. This is really key. Okay, so that means that this left septum gets closer and closer to this mitral valve as this closes off, okay, with decreased preload. And that's why the murmur gets worse with decreased preload. So if you were to increase preload, you increase the gap between the septum and the mitral, that mitral valve that we were talking about. Remember that mitral valve we were talking about? That's blocking off outflow from the left ventricle into the aorta. So if you increase preload, you increase that gap, and the murmur goes down. You decrease that murmur. So let's review real quick. So clinically, young athlete passes out while running. Now, why does he pass out while running? He was running, right? And then that increases his heart rate. It decreases the preload. He already has this issue because maybe his uncle had it. Uncle died of sudden cardiac death. His uncle had it or something. Remember, it was autosomal dominant. See how we're linking it all together? It was autosomal dominant. His uncle had it, or dad maybe. He passed out while running because he has this septum issue. That's what you're trying to figure out. But in your head, you're putting the pieces of the puzzle together. You're trying to put it together. He's like, okay, well, this is a young dude who passed out while running. There's a lot of reasons that you pass out. Differential here. Differential diagnosis includes dehydration, cardiac arrhythmia, decreased cardiac output, which could also be linked to the cardiac arrhythmia, but this could also be cardiac obstruction. Okay, so you have to think of those things. But then his uncle died of a cardiac death, so then you think, okay, well, he's probably got some sort of disease. You listen to his heart on the physical exam. Harsh systolic murmur on left sternal border. Okay, and I'll explain the location of this in a minute, okay? But it's going to be on the left sternal border. But you're going to hear the murmur on the left sternal border, just based on the location. And the locations of these murmurs, they're actually really easy. It's just based on the location. If I were to draw the ribs on here, the sternums would be right here. And actually more like right here. The sternum would be like right here, around here. And this would be on the left side. So, and it would be like under the second or third rib. And that's because the mitral valve and the aorta are right here. And you hear this murmur through here, right? Okay, so he's running, he decreases preload, and this valve and that come together, and he passes out. Boom, passes out. So that's how you're going to understand. Boom, he passes out. So that's how you're going to understand this murmur. Hopefully this is like somewhat organized enough, but I can sort of number it for you. So 1, increases the heart rate. 2, preload goes down. 3, this mitral valve blocks off blood flow from left ventricle to the aorta. That's 3 because the mitral valve is getting closer right here. So let's just number this 4 because they're kind of linked together right here. 4, and boom, you hear a murmur. 5, and then they can also pass out. That's that harsh murmur that you hear through there. Along on the physical exam, you can change the murmur. You can do things that can increase preload. So during the physical exam, how can we increase preload? How can we increase preload in the heart? Remember, preload is like the amount of blood in the heart, right? In the heart. So it's like the amount of blood that's like in the heart. So you can do that by, so bedside maneuver. So the bedside maneuver you could do is raise legs. So the bedside maneuver you could do is rapid squatting. This is, for some reason, this tends to be a little bit hard for some people to understand, but if you were to squat, if you were to stand, and then squat like right away, squat. All that blood that's like in your inferior vena cava like stays there momentarily. So if the blood's like down here, and here's his heart, the blood, like now his heart's like right here, and the inferior vena cava is like right there. All that blood sort of went into the heart, right? So that sort of increased preload. It's kind of hard for me to explain that in any other way, but rapid squatting, that increases preload. Oh god. Rapid squatting increases preload. So the murmur gets better, meaning the murmur goes away. Okay. So another bedside maneuver that we have is Valsalva, or even standing up right away. Standing up right away. Some of these patients, when they stand up right away, it'll decrease the preload. These things will come together closer, and then they'll pass out too. So this obviously decreases preload. Because Valsalva, what you're doing is you're increasing the intra-abdominal pressure. And so if you have this diaphragm here, and here's like the heart, here's the rib cage. I hope this picture is sort of making sense, but like if like the stomach goes in here, here's the abdomen, here's his belly button, right? Here's some abs. If you increase the pressure here, remember this is all about that inferior vena cava right here. Inferior vena cava flows up into the heart in order to give it preload. If you increase the pressure here, it actually like closes off this a little bit. Okay, it closes that off, and you get decreased preload. Okay, so that's why the Valsalva decreases preload, and the murmur gets worse. So that's not good. Okay, this one is way harder to understand because this doesn't have to do with preload now. This has to do with afterload. If you do hand grip, or you give them phenylephrine. So what does that do? So increasing your hand grip. Let's say you've got a dude, and he's increasing his hand grip. So there's blood flow arterially out into the hands, right? But he's gripping his hands so there's less arterial outflow from the heart. If the heart has less arterial outflow by increasing that afterload, like let's say, remember we had our left ventricle, right? We had our left ventricle that's like going out to the heart, and it's harder to push out. It's harder to push out. You're blocking out there after the aorta with either phenylephrine or a hand grip. This fills more, and this space increases because it's harder for you to get this blood out into the body. It's harder for you to do that. So therefore, that actually like increases preload. But technically, it's actually like increased afterload. But just think of it as increased preload, I guess, because there's more blood in here. So increased afterload actually makes this murmur better. Because what did we say? This space just increased, and remember that mitral valve that was right here? It's now away from that septum. I should have drawn the septum just as an example. Like this guy has that issue with that septum, right? So you've increased that space, so this makes the murmur better. Okay, so remember when I was talking about this increased preload stuff, etc., etc. So treatment. So I'm going to ask you now, how can we increase preload medically? Well, remember when they were working out, the increased heart rate didn't allow for the heart to really fill up as much because you're pumping it out. Just imagine like if you breathe really fast, you're not really allowing your lungs to expand all the way. In fact, rapid shallow breathing is not very good. It's not recommended when you're running. But that's just an analogy to this. If you're rapidly breathing your heart, you can't fill it up as much. So what should we do medically? You give them a beta blocker. This decreases the heart rate. This decreases the heart rate, and therefore increases the amount of time for the heart to fill with that preload. Okay, you can also ablate the septum, but I don't think that's a question necessarily that they would ask you. I think it's more understanding medically. Medically, how can you decrease that preload? What do you want to avoid in these patients? So, you avoid something that will. So, let me ask you again. What something would you want to avoid? You want to avoid something that would increase the heart rate, something that would decrease the preload, and you want to avoid something that would decrease the afterload. And there is actually a very specific drug, very important drug that does that when somebody's having like a heart attack. I'm giving you hints, and I want you to come up with it. Yeah, it's nitroglycerin or isosorbide dinitrate. And you avoid these drugs big time in these patients because, remember, these are venodilators. Venodilators. In order to decrease the preload into the heart and avoid the heart having to consume too much oxygen in the case of a cardiac MI. However, in these patients, you actually want to increase preload. Remember, this is a young dude, so he's not really having a heart attack issue. So you definitely don't want to give these. And I think that could actually be also a potential question because that's understanding the physiology. So the physiology here, remember this valve is blocking here. It's the proximity of the valve to the septum. You have to increase the preload in order to increase that space here. Remember, this is all visual. Use this as a visual key when you're thinking about this murmur, especially when you think about a young dude who passes out while exercising, okay?